Hi, good morning. Markin, the dentist, and laser dentistry again in our daily practice. So that's why I start with my safety glasses on to remind you that you always need to work with safety glasses when you use your laser device. Maybe erbium YAG laser, which we are going to talk about today, is not that dangerous as shown in previous episode YAG laser, but still safety first, and you always have it in the back of your head. So erbium YAG laser, the same device I showed last time, but the other part of this device, this is the erbium tip, this one here. So we don't use fibers like in YAG. This is our handpiece, so it transmits the light till the end of our tip, and the light is transmitted through articulated arm from our device. This is our control panel. So we have erbium mode switched, as you can see. Here I had three pulse duration options. Here I have 6 of them and some additional. 50 microseconds, 100 microseconds, 150, 300, 600 microseconds, as long as I remember. Here is sweeps mode used in endodontics and quantum shock pulse. It means that one pulse is divided in 5 sub-pulses, but it's not as important right now. We can choose our frequency. As you remember, frequency is in hertz, and you can choose your energy in millijoules, and that's it, I guess, for the beginning. So as you remember, as I told in the previous episode, YAG laser is absorbed in melanin or hemoglobin, so in pigments of our body. So effectiveness of its work depends on how many of these pigments patient has in its body. So you always have to adjust the parameters for the patient. In fact, erbium YAG laser absorbs in water. So here is the difference, because the effectiveness of erbium YAG laser will be different for different tissue types. So tissues that has more water in it will be ablated faster than tissues that has less water. But still, we can work with all tissues in our body, because all tissues has the water inside. So let me just show you. We have our patient again, which is shown before extracted third molar and the Polish sausage that will stand for soft tissues. Extracted molar will be hard tissues. Okay, so here we have our root surface, and I will show you one impulse. As you can see, something happened. So our laser cuts our teeth. Let me just increase frequency. As you can see, we are preparing the cavity inside the root. So what about enamel? Enamel has less water, but I am taking the same energy, the same frequency, and I start to work and see what happens. Still, I prepare some cavity, but I am not effective as much as I was in denting with this energy level, I mean, because I could increase the energy, but I additionally gave some water to promote my ablation process. And as you can see, my ablation goes much faster than without water. See. Okay, so this is how we work with our hard tissues. And now we are going to focus on soft tissues, because as I told you in the previous episode, we are able to work with soft tissues, but there is a different physical basis of this work, because erbium YAG laser does not absorb in pigments, but it absorbs in water. But still there is a water inside the tissue, in all tissues, in all areas of the tissues. So that's why we don't need to activate the tip, but we will be able to perform a cut in the soft tissue. So see what happens. We have adjusted frequency of 10 Hz, and I will reduce the energy up to the level of soft tissues. So it will be 120 millijoules and pulse duration 50 microseconds. And here we go. Let me just activate the device. Okay. And here we go. Okay, so as you can see, we performed with cut, no coagulation, just a clean cut, but the edges are a little sharp. I will increase my frequency twice, the same energy level, 120 millijoules, and I will perform another cut, the same hand speed. As you can see, I hope you can, cut is little deeper than the first one, and the edges are, let's say, smoother. Okay. I will set 30 Hz frequency, and let me just go with the cut. And again, cut is deeper than before. 40 Hz. Here ablation goes pretty fast, and my cut is again deeper. I still work with the same energy level. And 50 Hz. Or maybe this way you are going to see it better. Okay. And here we have a barbecue without cooling. Okay, so as you can see, we increases the temperature in the tissues, but when we give additional water, cooling and promoting ablation, and this is the same frequency, 50 Hz and 120 millijoules. Okay. As you can see, my cut is very smooth and no coagulation, and the deepest of all. So this is what changes when we adjust our parameters. Now I will show you the same energy but given 12 times slower. So this is the first cut we performed with 10 Hz. Here it is, yes. And again, this is 120 millijoules and 10 Hz, but 600 microseconds pulse duration. As you can see, edges are much sharper and the dip of the cut is more shallow. I will increase the frequency up to 20 Hz. Okay. And we start to cut. It is deeper, but not as deep as 20 Hz with 50 microseconds. And in fact, we cannot adjust more because it's physics. There cannot be more than 20 600 microseconds impulses in this device. Okay. So when we use our laser properly and we know our settings, we can work really fast and really effective. For example, when we take our hard tissue like here, and we can go with apiectomy, see what happened without cooling. So that's why we have to give some additional water in ablation process to do it right. Okay, so we were able to go with our apiectomy very fast and very effective and very safe. What is very important here in this case? So I think I showed you all the basics you need to know to start to work with erbium YAG laser. So you need to remember erbium is for hard tissues and for soft tissues, but there are some differences. First, when you work with hard tissues, you always want to choose the shortest pulse possible that your device gives you, because you want to provide the energy for the tissue with the shortest time possible to get the most effective result. But you always want to work with additional water as a coolant, so the first reason, and as the promotion of ablation process. You don't want to get your frequency higher than 20 Hertz in the most time, because the more frequency, the more pulses for the time unit, the more increasing of temperature, so the more possibility of damages and the more possibility of causing pain for the patient. Because I don't know if you know, but with erbium you are able to prepare cavity without anesthesia when you do it right. If you want to do it like this, you have to give enough energy to promote ablation, but not as much frequency to do not increase temperature, and then you will be able to prepare cavity without causing any pain symptoms for your patient. When you work with soft tissues, you can use both possibilities. When you want to cut fast and effective and smooth, you choose the shortest pulses and high frequency. Then your cutting will be smooth and deep, but you will cause bleeding. When you want to cause coagulation, you choose the longest pulses possible and the highest possible frequency you have, and by this you will cause coagulation, so you will be able to cut with controlled bleeding. So these possibilities you don't have with traditional surgical blade. For hard tissues you need to use higher energies. For short tissues you need to use lower energies, but always use the lowest energy that will give you result, but not too low, because when you work with hard tissues and you will use too low energy, you will cause increasing of temperature instead of ablation, and this is important to remember. So I hope those basics will help you in starting with working with your laser device. If you have any additional questions, write the comments and I am here for you. Take care, see you next time.